She is a 19 years old married girl with the complaint of severe pain pelvic region and was sent to rule out for any pathology without any investigative procedures or any gynecological notes, nor any lab profile whatsoever. So you see, this is the urinary bladder in the suprapubic region pressing the probe transversely. I see partially filled urinary bladder. Now I'm going longitudinally. This is the uterus of the female. This is the uterus of the female, all of this. And this is the cervix. This is the cervical area. It's appearing like this because the bladder, urinary bladder, is empty almost. This is the vaginal auricles and this is the cervix, and you see that there is no fluid in the cervix. This is the os, internal os, which is closed. Now if you see, there is a gestational sac, and in that you can see a fetal pole. The length of the cervix is 3.84 centimeters. Let's study this sac, this gestational sac. बेटा तेनू पता तेनू मर भी है? Yeah, she is aware of the fact. She is telling me she knows that she is pregnant. कितने महीने का बेटा?
2 महीने.
According to her, she is 8 weeks pregnant. And here what we are seeing is a gestational sac with a fetus here. Now this is the gestational sac, and the bright rim of this bright rim is the trophoblastic reaction, which is intact. Gestational sac is intact, and this is the fetus, which is measurable, and the fetus measures CRL is 9 weeks 3 days. So this is actually CRL is 2.68 centimeters, which corresponds to the gestational age of 9 weeks 3 days. This is the uterus. This is the uterus. So within the uterus we see this gestational sac and a fetal pole. This is the gestational sac, and this is the fetal pole. Now let us see if there is cardiac flicker. If you concentrate on this area, if you can keep your eyes on this area, you will see cardiac flicker. Okay, the cardiac flicker is present. And let's see if the waveform is present. Yes, here you get it. This is the cardiac activity. So this is a viable pregnancy of 8 weeks with a heartbeat of 138 beats per minute, 138 to 140, and the waveform is quite regular. See, the waveform is very regular. So this is the gestational sac, fetal pole, cardiac activity is present. So this is a single active alive fetus in the uterus. Where patient is very tender to the probe in this region. So we have seen this 9 weeks fetus. Let's magnify and see it. This is the magnified view, and you can see the cardiac flicker. This here, if you see in this region, you will see the cardiac flicker of this fetus. So 9 weeks intact intrauterine pregnancy. This is a magnified view, keep this thing in mind. And now you can see that there is fluid besides this gestational sac. This is fluid, this is the fluid. You see, this is the fluid. Going to the normal magnification. Now if you see, when I move the probe a bit anteriorly and laterally, I see another sac. And this sac shares the uterine outline. See, this is the uterus, and this sac appears to be sharing the uterus. Now see that this is an intrauterine pregnancy that we have studied in the uterus, intrauterine, and this is the wall of the uterus. Okay, this is extending anterior to this cystic area that is seen lateral